federal government says it is recording strong progress in fixing Nigeria's primary healthcare system. Speaking at the agency's quarterly media briefing on Tuesday in Abuja, the leadership of the National Primary Healthcare Development Agency says thousands of primary health centers are now undergoing revitalisation nationwide. Amina Ibrahim tells us more.
The executive director of the NPHCDA, Dr. Muyi Aina, presented what he described as a solid scorecard on Nigeria's primary health care reforms. He says renewed political commitments, policy reforms, and higher federal funding are driving the improvements.
A couple of months ago, the coordinating minister set out essential commodities, reproductive health commodities, maternal, newborn, and child health commodities to all of the 774 local governments in Nigeria. It's not enough, but I think it's important that we emphasize again that these are interventions by the federal government to bridge gaps. You know, the president is trying to push out commodities and in the hopes that when they get to the hands of the Nigerians that need them and that woman, that mother in our communities, then the financial pain of having to pay for some of these things is taken away.
Dr. Aina also announced major changes to the Basic Healthcare Provision Fund, the backbone of primary healthcare funding. Under the new framework, funds go directly to health facilities with strict transparency rules and performance-based incentives for health workers. He confirmed that 31 states have passed accountability checks and are cleared to receive their third quarter disbursements.
What we call low volume facilities, which is sort of the bottom 75 percentile of facilities in every state, will get 600,000 naira per quarter, while the higher volume ones will get 800,000 naira per quarter.
On immunization, the agency reports progress from expanded vaccination campaigns and targeted outreach carried out in collaboration with state governments and development partners.
About 1,642 or so health facilities that now have solar refrigerators as part of the revitalisation, where they can store their own vaccines, and the ability of community health workers to access them is easier. We've also revamped the distribution network. One of the problems that you have that causes outbreaks of disease is when there are stockouts of vaccines, or when there are no or the health workers cannot reach the vaccines where they are. So we've created a new hub in Lagos, we have a hub in Abuja, we have a hub in Kano that is being rebuilt.
Despite the scale of gaps still facing the sector, the agency says the foundation for a more responsive primary healthcare system are now in place. Amina Ibrahim, Trust TV.